Myself, Dr. Shaheen Sultana, Professor, IIMT College of Pharmacy. Today, I am giving a presentation on targeting method for formulations. Now, there are different approaches for targeting. Number one, physical, second, chemical, and the third is biological. In physical targeting, there is enteric targeting through enteric coating. Second is chemical targeting. There is drug targeting by retrometabolic design, which include the soft drug and chemical delivery system, or new glycone, new peptide albumin for cell-specific delivery of a drug chronically diseased liver. And the third is biological targeting that includes the gene delivery with the artificial viral envelope or through the retroviruses or viral envelopes. Now, enteric coating, enteric targeting. Now, enteric targeting through the enteric coating. The enteric coating formulations, they are the suitable vehicles to modify the release of active substances, such as the release at a specific target area. Means if you want to get the drug release at a particular area of a GLP tract, you have to go for the enteric coating formulation. The aim is if your drug is unstable at the acidic pH, then you have to choose the enteric coating formulation. It is important for the drugs such as enzymes and proteins because they are very sensitive to the acidic. They become inactivated in the acidic pH, and today so many drug delivery systems are based on the protein, enzymes, and genes. So antibiotics such as macrolide antibiotics, erythromycins, they can be rapidly degraded by the gastric juice. So in that cases also the enteric coating formulations are very famous. Others such as acidic drugs like anacids, diclofenac, valproic, etc. that needs to be enteric coated to prevent the local irritation of the stomach mucosa. So in order to prevent the irritation in the stomach mucosa or to prevent the degradation or release of a drug in the gastric mucosa, so we want enteric coating. So another purpose of enteric coating is drug targeting, like in case of 5-amino salicylic acid or the prodrug nasalazine and sulfasalazine. In these cases, the enteric coating is applied such that the drug concentration is increased in the lower part of the GI tract or in the intestine or a colon. Now, when you are preparing for the enteric formulations, you have to take consideration of a physiological parameter such as pH. Now, the lower pH it is observed in the stomach, while the high pH it is always observed in the colon or intestine. So, enteric coating should contain of a polymer that is able to release the drug at a predetermined pH. Means it should not able to release the drug in acidic pH or able to release the drug in the alkaline pH of the intestine. Now, ionic state. Now, some of the polymer that is used for the enteric coating, it is negative charge, means it is anionic character. So, their dissolution, it is depend upon the ionic character of a medium. So, the medium is of what character? It contains, it is alkaline or it is acidic. That will govern the dissolution of the polymer. So, researchers found that sodium content is high in the stomach and it is low in the stomach, and towards the intestine it will become increased. So concentration of these cations, it plays very important role in dissolution of the polymer, because in intestine these cations is high. So when your formulation is coated with the anionic polymer, because of the cationic polymers, it will support the dissolution of the polymer. Now the third effect, it is the food effect. Now, the intake of the food or beverages lead to the increase in the gastric pH. In addition, depend upon what is the composition of the food. The hydrophilicity of a gastric medium, it is affected. Now, food intake also affect the gastric emptying transit time, gastric emptying, or the transit time of a dosage form. So, you have to take care about what food you are taking, what is the composition of a food, because it can affect the pH also, it can affect the transit time of a dosage form also. For example, aqueous ethyl cellulose dosage form, it was found that enteric coated formulation, when you take the fatty meal, the plasticizer will be leached out from the filling, causing the degradation of the enteric filling, and the drug will be released out into the bulk environment. So, in case of ethyl cellulose dosage form, and you are taking the fatty meal, so you have to take care. So it is important that anterior-coated formulation should be administered before the intake of a meal. As the meal may contain fatty substances, it can affect the plasticity of a film and therefore causes the degradation of the filling. Now next is the gastric ampule. Now the standard anterior-coating formulation, it should be short time, it should be in the stomach, and long time it should be in the intestine, and release the drug and show the action. But gastric amping rate, it will affected by the food or by the type of formulation. For example, if the palate is there and the palate density is 2.4 gram per centimeter cube and the size is 1.2 to 1.4 millimeter, then it was found that the gastric amping of a dosage form will not be affected. But however, if the density is 2.8 gram per centimeter cube, then it showed the change in the gastric emptying time. Means your gastric emptying time, it will be slow. Now the food also, you have to take care that will not affect the emptying of a palate formulation. Like gastric emptying process, it is also you have to take care about in the patient. Like the patient in which the gastric emptying, it is impaired. Like elderly patient, because of the resting stage, the gastric emptying is slow. So you have to use the polymer that can be retained or that will not be degraded in the stomach when it is remain in the stomach for a long period of time. So you have to use some other polymer that will show prolonged retention without degradation in the stomach. Then enzymatic status, that is proteolysis. The proteolysis is the breakdown of a peptide and a protein in the presence of a vaccine. So because so many drugs are based upon the peptides and the proteins and enzymes, and they can be degraded by the vaccine that is present in the stomach. So prevention of proteolysis is very important for the anterior-coating. Now today, most of the drug delivery system, it is based upon the hormones, enzymes, etc. Now, so you have to control the thickness of your thickness of a film. It should be controlled. Proper thickness should be there. That so that you can resist the degradation of the enzyme that is present in the stomach. Now, also the combination of anterior-coated protein drugs and anterior-coated protease formulations, protease inhibiting molecules can be used. That will prevent the degradation of a drug or degradation of the protein in the stomach. So there will be increased absorption has been found and increased bioavailability. So anterior-coating, that is used, it should be able to retain in the stomach, not degrade by the enzyme, and able to show the predetermined release. Now age. It was found that no significant differences was there between the elderly and the younger people in the adjustment of a pH under the fasted and the fat condition. Now in some cases it was found when the age is 71, then the gastric pH was found to be elevated in the fasting state, means the gastric pH can be increased to 5. So if the pH has been increased to 5, there is a chances of dissolution of the anterior-coated polymer in the same pH. So you have to take care about the pH of the polymer when you are preparing the gastric anterior formulation for the elderly. Okay, so in that the higher dissolution pH or polymer with a higher dissolution pH, it should be recommended. Now, the pathophysiological changes, like there is certain diseases like inflammatory diseases, like Crohn's diseases, ulcerative colitis is there that will impair the drug absorption. So here in that diseases, this change in the pH is slightly increased in that cases or pathological conditions. So pH increases, so it will complicate the dissolution of the polymer and therefore affect the target. Now, what type of dosage form that you can prepare? There can be the tablet. Tablet, it can be anterior-coated tablet. Variety of anterior-coated tablet it is available in the market. Researchers find that the increased stability of acetyl salicylic acid tablet was found when anterior-coated formulations was when the acetyl salicylic acid was anterior-coated. Now, if high stability, there will be the reduction of the side effect and increased patient comfort. In another study, it was found that the product that contains hydroxypropyl methyl cellulose phthalate will adhere with the gastric mucosa. When it adheres with the gastric mucosa, it causes irritation and inflammation of the gastric. Whereas if methacrylic acid copolymer used, no irritation, no inflammation was noticed, and therefore the HPMCP was inferior as compared to the methacrylic acid copolymer and capsule. Now capsule also, you can use capsule also, but when capsule it has been used, you can use hard gelatin capsule. You can coat the shell with the anteric-coated polymer. Now, it is important when you are coating that increased plasticizer content should be there. Proper layer of coating should be there. Otherwise, if plasticizer is not sufficient, the capsule shell will become brittle upon store. So you have to take care about that. Anteric film coating with a methacrylic copolymer and starch capsules that is filled with 5-acetyl salicylic acid. It shows good storage stability. Similarly, good storage stability or good stability was found with acetaminophen when the high gelatin capsule is coated with the anteric polymer. Now, cellulose acetate phthalate was used as the anteric polymer on hard gelatin capsule that is filled with the aspirin crystals. Now, multiple unit life in the form of a sachet can be given. There is a film-coated granules, anteric-coated granules. They are filled. Granules are coated with the anteric polymers and then filled in a sachet and given to the patient. Now, the studies show that the anteric-coated erythromycin palette in capsule was found to be superior to anteric-coated tablet. Why the anteric-coated tablet is less effective it is less superior as compared to the sachet, as compared to the granules? Because of the granules, a small size, it shows fast passage from the stomach to the intestine. Short passage time of the coated granules from stomach to the intestine, so it will deliver to the target area in a short span of a time and therefore show the effect and enhance bioavailability. Now, the second is the drug targeting by the retrometabolic design. Now, the rational drug design can takes place when you incorporate the metabolic concentration into the design process. Like retrometabolic approaches is what? It is combining the SAR with SMR. SAR is the structure-activity relationship, with SMR is structure-metabolic relationship. That will allow you to design the safe and selective drug delivery system that is able to target to the delivery site. Now, in retrometabolic drug design, it contains two types of delivery system. One is using the soft drug and the other is chemical delivery system. Now, what is the soft drug? It is the isosteric or isoelectronic analogs of a drug, of the main compound. That is, they show the therapeutic effect. After showing the therapeutic effect, it will be deactivated in a predictable and a controllable manner. Now, you can see here in the table, in the schematic diagram, that soft drug design is what? It is using the isosteric or isoelectronic analogs that allow a predictable metabolic route after exerting a therapeutic effect. After exert a therapeutic effect, it will be metabolized and excrete out. And the chemical delivery system means it is inactive as such, but after metabolism, it will convert or release the active form of a drug that will show the action. So the chemical delivery system, it is the delivery system that is made up of chemical compounds that is produced by the chemical reaction. Means that it forms the covalent bond between the drug and the carrier. Now the drug that is able to produce the therapeutic effect, the carrier is what? That is to deliver the drug to the targeting area. At least the one chemical bond has to be break. It is bound together, the chemical drug and your targeting molecule is bound together by the particular chemical bond. This bond has to be break by the enzyme or by hydrolysis. Now the CDS, it is inactive, but upon hydrolysis, upon enzymatic degradation, it becomes active. Now the CDS, they are active therapeutic agent that is rapidly metabolized into the inactive species. Now the drug that is introduced into the body undergoes several enzymatic transformations. Now what type of transformation will carry out? It depends upon the structure of the molecule. So during the enzymatic molecules, the enzymatic processes, the drug undergoes so many structure changes. That is not physical chemical, that will change not only the physical chemical property, but also the biological property of a molecule also changes. And hence the drug metabolism, it is unquestionable. In the drug metabolism, it is unquestionable. It is very important. When you are designing a drug delivery system, you have to take consideration of a drug metabolism. Then you can only design an appropriate drug delivery system on the basis of its SAR. Now, so the relationship between the SAR and SMR, structure activity relationship, structure metabolism relationship, this is known as vitro-metabolic drug design application. Now, the drug targeting by the CDS, the chemical delivery system, the drug targeting. The chemical delivery system, they are inactive chemical derivatives of a drug, where one or more chemical modifications have been performed. But after metabolism, they will perform an inactive monomer or active monomer that will show improved delivery characteristics. Now, the chemical modification has the chemical delivery system has two basic goals. One is the targeting, and the second is to modify the distribution, elimination, and activation of the drug molecule. Now, in one of the modification, you can add the targeting molecule. What is targeting molecular moiety? That it is the group that is responsible for the site targeting. The TOR, it is the modifying group that not able to only the target, bring the molecule to the target site, but also it changes the molecular property of a molecule as a result of an enzymatic conversion, because it involves the pharmacophores. That is, pharmacophores means the group that is capable of undergoing the specific enzymatic degradation or site-specific enzymes to perform the function. So after metabolism, it will release the drug. That drug will show the action and target molecules not only responsible for site-specific targeting, but also produces the changes the molecular property of a drug. So when we compare the carrier and the targeting molecule or TOR moiety, the carrier is the molecule that is used to target the drug, just carry and release the drug to the particular site of action. But the TOR molecule also that is used for targeting the drug molecule to the particular site of action by modifying the physical, chemical, and physicochemical molecule. How it is modifying the physical, chemical, physicochemical properties of a drug? By some kind of chemical enzymatic reaction. Now, chemical delivery system, it is of three types: enzymatic, site-specific, and receptor-based chemical drug delivery system. Now, in enzymatic, the targeting drug, it is chemically converted into the inactive analog by the use of the enzyme or by chemical. The TOR molecule is modified metabolically, result in altered the distribution or solubility. If solubility distribution is altered, its biological property will be altered. The example is given the brain target. The blood-brain barrier, it is permeable to the lipophilic drug. But what happens if the drug is hydrophilic? It will not show any penetration to the brain. So if a CDS, it is made up of hydrophilic drug, it cannot penetrate the brain. So in that cases, the CDS is made lipophilic by introduction of some group or some modification. Now the molecule get across the blood-brain barrier and get converted into the hydrophilic drug molecules inside the brain. And because of conversion of the hydrophilic drug molecule inside the brain, it cannot come out. It will be locked out inside the brain. Now, site-specific enzymatic activated drug delivery system means that will convert it into the active form by the enzyme on a specific site. So it will lead to the high site specificity. Usually, the drug molecule contains COH group or OH group so that it can be easily modified. So our target are these groups, COH group or OH group. We have to esterified these groups. These groups, upon esterification, they will convert from hydrophilic into the lipophilic molecule. So when it is converted into the lipophilic molecule, so it will show high penetration across the lipid membrane. High penetration, so it will be able to target the biological molecule and show its effect in a particular manner. Now the drug, it has been formed, such as ophthalmic prodrug, it will form. D.Pharm is there. it contains 2 hydroxyl functional group of epinephrine. Means the main drug is epinephrine. The epinephrine hydroxyl group, it is modified into the ester group. The ester group, it is known as D.Pharm. Now this D.Pharm, it will show enhanced corneal penetration 10 times higher as compared to epinephrine. Okay, that show 10 times high therapeutic index as compared to the epinephrine. Now the ester product, it has having high corneal penetration, so it will penetrate. Inside the eye, esterases is present. So esterases break down the D.Pharm into the main drug, which is epinephrine. Now then epinephrine, it will show the effect inside the eye and retain there for a long period of time and show its action. You can see here in the diagram that this is the D.Pharm. Now D.Pharm, it show because of its lipophilic property, because of the ester product, it show high penetration into the eye. Now inside the eye, there is esterases. These esterases hydrolyze the D.Pharm and release the active drug, which is epinephrine, and epinephrine show the effect inside the eye. Now the drug targeting by the soft drug. Soft drugs are the novel active agent that will show some metabolic deactivation. Means it contains some metabolic group that is sensitive to the enzyme that will metabolize once the drug show its action. So soft drugs simplify the transformation distribution activity profile that the specific drug otherwise exhibits. So it will show the transformation distribution activity profile. Means at a particular distribution, it will metabolize. So soft drugs are active and consequently they will produce the pharmacological effect. And after producing the pharmacological effect, after removing from the site of action, they will metabolize by the enzyme or by the proper mechanism. When applied to the desired site of action, it is topically or internally, it will show the pharmacological effect. After showing the pharmacological effect, it is distributed from the site of action and be deactivated by the enzymes or by the metabolism. Hence, they can prevent the unwanted side effect or unwanted characteristics. This is the main aim of a soft drug, that after, if any drug causes after metabolism, they show high side effects. So this soft drug concept has been introduced that they metabolize in such a manner that the metabolic effect do not cause any side effects. The soft drug concept is introduced to reduce the unwanted side effect of a main drug. Soft analogs are close structure derivative of a non-drug or biocompound that is designed with a specific weak spot in the structure. It will allow the one-step deactivation into the non-toxic metabolite. For example, the acetylpyridinium chloride. It is converted into the isoelectric acyl alkyl pyridinium soil that is hydrolyzed easily and excreted out from the body. And this is pyridinium salt, acyl oxyalkyl pyridinium salt. This is 10 to 40 times less toxic than the main drug, which is acetylpyridinium chloride. Activated soft compounds, they are not the analogs of a non-drug, but they are derived from a non-toxic chemical compound. By how? By the introduction of a particular pharmacophore. The added groups get deactivated inside the body and inactivated starting molecule, it has been regenerated. And chloramine, antimicrobials, they are a very good example where di-substituted amino acid esters and amide serve as a source of a positive chlorine. And as soon as the chlorine it is removed, the non-toxic initial amine it is regenerated, which is removed from the body. Now, the brain targeting chemical drug delivery system, within this approach, the drug it is modified in such a way that it is able to penetrate the blood-brain barrier. So, blood-brain barrier, it is the biological barrier through which the lipophilic drug can be penetrated, but hydrophilic drug cannot be penetrated. So, if a lipophilic compound that can alter the brain is converted there to the hydrophilic molecule, so it will be locked in and cannot be removed from the brain and show its effect inside the brain. Means your drug is lipophilic. When it is lipophilic, it has capability to cross the blood-brain barrier. When it crosses the blood-brain barrier, it will release by the enzyme or break by the enzyme to release the active drug that will show the action. So here the diagram it has been shown that this is the drug. One example it has been shown that upon oxidation, this drug produces the intermediate which upon hydrolysis by esterases, it will release the active drug, which has no or poor CNS. Means it cannot cause any CNS because it is not able to penetrate the blood-brain barrier. But what happened about this molecule? So this fast drug molecule, it is lipophilic in nature, so it has capability to penetrate the blood-brain barrier. Inside the penetration into the blood-brain barrier, it will oxidize, and upon oxidation, it will form an intermediate which has capability to locked inside the brain. When it locked inside the brain, it will hydrolyze by the esterases to release the drug active molecule that will show the targeting effect. Now the next is receptor-mediated targeting. This is receptor-mediated targeting means you have to add some ligand to your drug carrier molecule, some ligand to the drug molecule that is able to deliver the drug to the particular site. For example, bisphosphonate is used as a ligand for targeting the bone tissues. Selectin adhesion molecule is used as a ligand for targeting the vasculature endothelium. And transferrin and folate, it is used as a targeting ligand for targeting some classes of a cancer cells. Ligand, it is attached to the drug directly, or you can formulate some formulations like nanoparticles, nanopolymeric, solid lipid nanoparticle, etc. And then you can attach a ligand to the drug delivery system. Now, albumin in the liver disease. Now, the patient with a chronic liver diseases such as there is cirrhosis, fibrosis, hepatitis, they want long treatment. When long treatment, the drug will show side effect for a long period of time and causes unwanted side effect and damage to the body. So our aims for targeting liver diseases is that the targeting can be achieved only to the liver cells, and unwanted side effect by removing the drug from unwanted area can be achieved. So this can be achieved by using the albumins. Albumins can be used at targeting cell-selective delivery system. Now, the drug targeting, it will manipulate the whole distribution of a body and therefore prevent the distribution to the non-targeted cell. Or concomitantly, it will increase the drug concentration in the target cells. Now, the carrier molecules are designed for selective cellular uptake and therefore take advantages of a specific receptor binding site that is present on a cell surface of a target cell. Now, the targeting by drug albumin conjugate in a hepatic diseases. Now, albumin, you can take albumin, this is the protein. Now, albumin, you can add with the albumin, sugar molecule, charge molecule, or peptides. When adding albumin, the sugar or charge or peptides, it is able to specific or target to the specific type of a cell. The combination of a receptor density on a cell and degree of substitution of a receptor like, it will determine the cell specific activity. Means what molecule you are incorporating, how much amount you are incorporating the ligand, it is capable of targeting the particular molecule, a particular receptor, the density of a receptor, how much density of a receptor is available. All this determine that how much drug will be accumulated. For example, the targeting to hepatocyte, it is well established. Now, albumin, you will take the albumin, add 13 sugar molecule of a lactose into it. Then it will show high accumulation of hepatocytes. Hepatocytes means the cell that is present in a liver. So, because hepatocytes, they contain ASGP receptor, they express ASGP receptor. So, when albumin binds with a sugar molecule such as lactose, the lactose has a ability to bind with the ASGP receptor. So, when binding takes place, there will be the high retention in the targeted area. So, ASGP receptor is a receptor that is expressed on the cell of a liver, and therefore it offers the possibility of a site-specific targeting. In the diagram, you can see the hepatocytes. So, hepatocytes, it will express the receptor which is ASGP or ASGP receptors are there. Now, you can take nanocarriers and you can attach the lactose group that contains the galactose. Okay, that contains the galactose moieties. Now, this galactose, they are able to bind with the ASGP receptor that is expressed on a hepatocyte. So, in that way, after binding, the drug can be targeted specifically to the liver cells, prevent the drug accumulation to the unwanted areas. Now, monosylated albumins, it is the albumin carrier. Monosylated means the albumin can be bind with a mannose group in combination with the negative charges. Negative charges can be introduced by the succinic anhydride or cis-aconitic anhydride, etc. These group can be introduced to the albumin. When you increase this group to the albumin, it will become negative charge. So negative charge albumins also they have a particular targeting efficiency for the scavenger receptor. Scavenger receptors, these are the receptors that is expressed in the cells that show no immunity, that show apoptosis, cell death, or cell unwanted growth like cancers, etc. on endothelial cells. So monosylated albumin, they have capability to bind with the endothelial cells and therefore achieve proper targeting efficiency. Similarly, new glycoprotein carriers, they were synthesized. New glycoprotein carrier can be synthesized by adding mannose albumin with the by modification of the albumin with a mannose 6-phosphate group. Means you will add the albumin with mannose 6-phosphate group. It will show high accumulation in a hepatic stellate cell. What is stellate cells? Hepatic stellate cell, they are the cells that is expressed in a fibrotic liver. Where there's a liver fibrosis, each type of cell it will be expressed. Now they have found that increased accumulation of mannose 6-phosphate, it will be found, increased accumulation of a drug has been found when the phosphate group has been shifted from 10th position to 28th position. So increased accumulation is there, and therefore increased drug accumulation, increased targeting efficiency. So in another experiment, a covalent coupling of a naproxone to the albumin, it results of successive targeting of naproxone to the liver. Means bind the albumin to the naproxone. It was found 30 times higher accumulation of a drug when naproxone bind with the albumin as compared to the free naproxone. Okay. So because the conjugate binding of the albumin, it will causes the selective uptake by the liver cells only, high drug accumulation, and therefore high targeting efficiency. Similarly, the gene delivery with the artificial viral envelope. Now, what is the gene delivery? There is so many diseases which is genetically inherent. So in that, the DNA or DNA, RNA, etc., genes it is modified or it is altered, or there is the abnormal growth of a gene that leads to the generation of a particular diseases. So in that, the gene delivery concept introduced means you will deliver the gene, DNA or RNA that is capable to deliver, that is capable to modify the to change the modified gene or to replace the damaged genes. So in this way, the inherited disease can be cured. So with a gene therapy, the disease can be treated by the injection of a nucleic acid sequences such as DNA, RNA, etc. And you have to deliver the DNA, RNA to the particular disease area. Researchers in that the viral envelopes can be used like retroviruses is there, adenoviruses is there, etc. They show selective uptake by the cells and deliver the gene directly to the infected areas. But nowadays, artificial viral envelopes have also been used, which is known as liposomes, because they also mimic the fusogenic envelope of a retrovirus. So there will be the increased targeting efficiency such as virus. So these are artificial viral envelopes such as liposomes is here. They're negative charge. They contain high fraction of a cholesterol, and they are made up of lipids. So lipid, they are made up of lipids. So lipid content it is same as like a lipid membrane. So because of the major component of a lipid membrane they contain, so they shows high acceptance by the body, high penetration, and high targeting efficiency of a drug delivery system. And because of the negative charge on the liposome, these targeting moieties, such as viral binding proteins, can be inserted or attached, or ligands can be attached on the surface of a liposome. Here, the development of a HPG liposomes I have shown. See here, the first step is that the DNA is there. You have taken the DNA. DNA, it will be mixed with a protein. Now, what is the function of this protein, nuclear protein? Nuclear protein, it will enhance the expression of a foreign DNA nucleus, increases the protein synthesis. That's why the nuclear protein, it will be mixed. Now, when you mix the DNA with the nuclear proteins, Now the DNA, modified DNA, it will then mix with a lipid. Folic acid will form the DNA containing liposomes. So this DNA containing liposomes then mix with the inactivated HBG virus. So HBG viruses, it will entrap the DNA containing liposomes. So when it is injected into the patient body, it is able to deliver the gene inside the cells and therefore replace the damaged areas of the gene and promote the expression of a newly synthesized gene and can cure the inherited disease in a more simplest way. Now, thank you so much. My lecture has been finished. Thank you so much.